When a health crisis emerges, who were the detectives on the scene? They're not wearing trench coats or carrying magnifying glasses. Nope. Their clues are data. Their crime scenes are entire communities. And their whole mission is to solve the mystery of what's making us sick. So let's follow the clues.
At the very heart of this detective work is a science called epidemiology. And honestly, it has a surprisingly simple definition: the study of what befalls people. That's it. It's all about looking at entire populations to find patterns in health and illness, tracking the who, what, where, when, and why of a disease.
And that really brings us to the central question, doesn't it? How do you hunt down a killer you can't even see? We're talking about a virus, or a toxin in the water, maybe some hidden environmental risk. Solving that kind of mystery, well, it requires a completely different set of tools and, frankly, a revolutionary way of thinking. Our story actually begins not in some high-tech lab, but on the grimy streets of 19th century London. There's this terrifying cholera outbreak, and pretty much everyone believed that disease was spread by bad air. But one doctor, John Snow, he had a pretty radical idea. He believed the clues weren't in the air at all, they were hiding in plain sight. So what Snow did next was truly revolutionary for his time. I mean, he didn't have a microscope, he had a map. He went out and plotted every single cholera death, and an undeniable pattern just jumped off the page: a deadly cluster centered right on the Broad Street water pump. He took his evidence to the officials, they removed the pump handle, and just like that, the outbreak stopped. Snow proved that disease had a source, and if you could find that source, you could stop it. This was literally the birth of disease mapping, a foundational act of community health assessment.
John Snow's work really laid the groundwork for everything. Now, today's public health detectives, they have a much more sophisticated toolkit, and it starts with a simple but incredibly powerful model for understanding any health problem: the epidemiologic triangle.
Okay, so first up, you've got the agent. This is the what, the actual thing that causes the problem. It could be a virus like the flu, a chemical like a pesticide, or even physical trauma from something like a car crash. This is the culprit the detective is hunting. Next up is the host. This is the who, the person or the animal that's affected by the agent. And here's the thing, not everyone is equally at risk. Factors like your age, your genetics, even the strength of your immune system can make you more or less susceptible to that agent. And finally, we have the environment, the where. This is the crucial piece of the puzzle that brings the agent and the host together. It can be the physical environment, right, like a warm climate where mosquitoes thrive, or it can be the social environment, like crowded living conditions that help a virus spread. Disease really happens when these three things line up just right. Let's put this triangle into action with a real case, the Zika virus. So here, the agent is the virus itself. The host is a human, but the environment is totally key: tropical climates with standing water. That allows the vector, in this case the mosquito, to breed and then transmit the agent to the host. If you can break any one side of this triangle, you can stop the outbreak. It's that powerful. Now, the triangle is a fantastic tool for a single culprit. But what about health problems that aren't so simple? I mean, think about chronic illnesses like heart disease. There isn't just one agent. For that, detectives use a different model called the web of causation. It shows how dozens of factors, genetics, diet, stress, even your zip code, are all tangled together. To untangle a web like that, you need the right data. And two numbers are absolutely essential. Picture a bathtub, okay? Incidence is the water flowing from the tap. It measures the new cases and tells you how fast that tub is filling up. It shows the risk, the speed. Prevalence, on the other hand, is the total amount of water already in the tub. It measures all the cases, new and old, to show the total burden on the community. And get this, these two numbers can tell surprisingly different stories. Let's take rabies. It has a terrifyingly high case fatality rate. We're talking 99%. So, during an outbreak, the incidence, the rate of new cases, might spike. But because the disease is so fatal, people don't live with it for long. That means the prevalence, the total number of people living with rabies at any given time, stays really, really low. Modern public health isn't just about reacting to outbreaks anymore. It's about preventing them from ever happening. And this is where something called the precautionary principle comes in. It's a game-changing idea that says we shouldn't have to wait for absolute scientific proof of harm. If something poses a credible threat, we should take protective action. And crucially, it shifts the burden of proof from you and me to the manufacturer to prove their product is safe. And applying that principle starts right where we live. Because our own homes can hide invisible dangers. I'm talking about lead from old paint, which can cause permanent brain damage in kids. But the fix can be as simple as wet mopping instead of sweeping. Or carbon monoxide, the silent killer from a faulty furnace, which is stopped by a simple detector. And then there's radon, a gas that seeps up from the soil and is the second leading cause of lung cancer. And the terrifying part? The only way to know it's there is to test for it.
All of these actions, they fit into a bigger strategy called the levels of prevention. Think of it in 3 stages. First, primary prevention stops a problem before it even begins, like getting a vaccine or wearing a seatbelt. Second is secondary, which is all about catching it early through screenings like mammograms. And if the disease is already there, tertiary prevention focuses on managing it to improve quality of life through things like rehab programs or support groups.
But what happens in the absolute worst-case scenario? A natural disaster, a terrorist attack, a mass casualty incident. In those moments, all the models and all the theories are put to the ultimate test, and the decisions that are made in seconds can mean the difference between life and death.
In a disaster, the goal is simple but brutal. Do the greatest good for the greatest number of people. And that requires triage. The first priority is always the red tag patients. These are people with life-threatening injuries, like a sucking chest wound or severe bleeding. But, and this is key, they have a high chance of survival if they get immediate care. They get treated first, no questions asked.
Next up are the yellow tags. These people have serious injuries. We're talking things like an open fracture. But their condition is stable enough that they can wait for treatment without immediately dying. They become the second priority.
Then you have the green tags, for what we call the walking wounded. These are people with minor injuries like cuts or sprains. The main goal here is to get them to a safe area, away from the chaos. This not only keeps them safe, but it clears the scene so rescuers can focus on the red and yellow tags. And often these green tag folks can even become a resource, helping to comfort others or do simple tasks.
And then there's the most difficult category of all, black tag. These are for individuals with injuries so catastrophic they aren't expected to survive. The protocol is just gut-wrenching, but in a disaster, it's tragically necessary. You provide comfort measures only. You do not stop to perform CPR, because the time and resources you'd spend on one person who cannot be saved, well, that's time taken away from saving multiple people with red tags who can. So, as you can see, from mapping cholera in a London slum all the way to triaging victims at a disaster scene, the mission of the public health detective is just incredibly broad. They really are our modern health guardians. They advocate for safer policies, they assess those hidden risks in our homes and workplaces, they protect the most vulnerable among us, and they prepare all of us for the worst. It's a role that really combines science, action, and advocacy. And it leaves us with one final thought. The clues to our collective health, they're all around us, in our homes, our habits, our policies. So the real question is, who's paying attention to them in your community?